Welcome back to another episode of Novus News. I'm Stephanie Wolff, PA and CEO of the Novus Center here in Studio City.
And I'm Jada Pasquale. I'm the registered nurse here at the Novus Center.
So today we're here answering your questions regarding Shockwave for cellulite treatment. We get lots of questions by you guys, both when you come in for treatment and then during the consultation, or maybe I get little texts or emails. So we really wanted to address them here in this video. And of course, the number one question we always get.
Yes, does this really actually work? And I'm here to tell you, yes, it does.
But how do you know that, Jada? Can you please explain?
Yes, so like we talked in previous videos, what is cellulite? Cellulite is the clumping of the fat cells that are protruding through the dermal layer. And because of the fibrous bands that are pulling, it's just exaggerating those lumps and dimples that we all have. And so what shockwave therapy does is it's causing this sound wave beyond the skin layer. And as we're putting this handpiece device beneath that dermal layer, it's stimulating this cavitation. And cavitation, like we mentioned in previous videos, is just the micro bubbling of the molecules down there. And it's causing this signal of micro trauma that the body is signaled like, hey, what's going on down here? So the body naturally will send fibroblasts to that area, and it basically will create collagen, new tissue.
Right.
And with new tissue, we need that blood flow to enter. And with fat cells in that area, it's impeding that blood flow. So this shockwave therapy is breaking down that fat to allow that blood flow to enter and to increase that blood flow to enter, to increase that collagen production, right? So yes, it does actually work if you really look at how this anatomy and physiology works.
Exactly. So of course, if it does work then, when am I going to see results? How long do I have to keep doing this? And how many treatments do I need?
Oh, yes, yes. I love these questions when they're back to back. Okay, so with treatment, we have women come in here 8 to 10 treatments, twice a week for 4 to 5 weeks, and it's like 30 minutes, 30, 40 minutes.
Yeah, just depending on the surface area that we're treating.
And it's not too long. And, a lot of these women, we're starting to see results after the 4th treatment.
Yeah, it's pretty amazing.
Yeah.
And the nice thing about it is there's no downtime. So, we have women that come in here and right afterwards, they go on their date or they go back to work or, they just go about their lives. There's no bruising, there's no swelling, there's no pain, there's no numbing creams. You're not like getting all the stuff everywhere. It's pretty simple, believe it or not.
Right, and then, another question that they ask is, what do they do after?
Yes.
Is there anything that they should be doing,
Yes. So here at the clinic, there's a couple things that we do, and one of them is the dry brush. So a dry brush, to me, the easiest way to explain it is it kind of looks like one of those horse brushes.
Yeah.
It's a very small brush, but it has coarse hair, really. And what you're doing is you're going to be obviously on dry skin. So I always tell patients, get in the shower before you actually take a shower. And you want to brush up. So you're gonna start with your toes, start with your legs, work your way up. And what you're doing is you're promoting this lymph drainage and blood flow or circulation back up to the heart. Remember, the heart is feeding rich oxygenated blood to the rest of your body. That's including your tissue and your organs. So if we can, start to move all these toxins and all this inflammation that's happening within your body back to the heart, it can process all of that and start feeding out that rich oxygenated blood to the tissue.
Right.
And the nice thing about the dry brush too is it's getting rid of all the dead cells, right? So, patients are noticing that their skin is smoother and it's just a little bit more, more pink and more toned. So, you should be using a dry brush regardless if you're going through this cellulite treatment, believe it or not. And quite honestly, you can buy them on Amazon, I believe, for like $10 or $20. So it's very inexpensive and something that you can do at home. The second thing that we do here is we use what's called a non-peptide cream. and it's a combination of 2 medications. One of them is called glycerotinic acid, and the other one is aminophylline. And these 2 together promote lipolysis, or basically like fat burning cream is the best way for me to explain it, while also helping with glucose control. So they are using this cream to treat obesity and fat loss. There was a study that they actually did where these patients applied it around their waist twice a day for 12 weeks, and they lost approximately 11 to 12 centimeters.
11 to 12.
Yeah, around their waist circumference. So the cream works, and we do use it here in the clinic. So know that that's an option.
Yeah.
So I have another question for you.
Okay.
I have a patient who, she came in and she said, you know, it's funny because since I started getting cellulite treatment, I noticed that I no longer have the muscle soreness that I used to have. My IT band is loose. You know, my piriformis muscle is loose. I no longer have back pain. My hamstrings feel better. Does shockwave therapy do anything for muscle soreness?
Yes. So we have to also look at the anatomy of the body.
Yeah.
So the fibrous bands are actually attaching to the dermal layer and to the muscular layer. And so when we are causing this shockwave therapy on that, you know, the muscles are also getting this, you know, sound wave effects. Right. And how muscles are attached to each other, they're all connected in some way. So when a woman says that, oh, my back no longer hurts, and when I'm not treating her back, when I'm treating her like hamstrings area, it's just because it's no longer pulling on that.
So, and it's feeding blood flow, right? So now you're getting blood flow to the muscle, right? And you're moving out all those toxins and inflammation. You're loosening up any of the scar tissue that they may have. A lot of patients come in here and they've got these really tight IT bands because they never stretch. Doesn't that sound familiar? I feel like you just said that about cellulite.
Yeah.
So it's almost like these IT bands look like the fibrous cords that, you know, are basically retracted and tense, which is making the cellulite happen. So if you kind of think about it logically, you know, really it's all about stretching, blood flow, you know, creating new tissue and collagen, because as you know, as we age, that collagen and tissue begins to atrophy. And as it begins to atrophy, the skin becomes thin, right? Which means no more blood flow is happening, or maybe it's very limited blood flow. And so really, you know, all these things kind of start to deteriorate. And, you know, we're here to tell you that you don't have to put up with that. We can actually improve that. And that's what shockwave therapy is. So any other questions that you can think of that patients have asked you?
So I have a patient who has, it's not actually cellulite, but it's actually very loose skin on her stomach area. She's postmenopausal, and she wants to help with that area. How does shockwave therapy help with that?
Well, it's interesting because, you know, she's wondering, well, I don't have a lot of fat cells, so there's nothing protruding, but my skin is really loose and I don't really understand what happened. And as we were discussing, you know, she has had a couple of children. So if you think about the way that her stomach expands when you're growing a baby, and the way that our connective tissue is vertical, right? So you get this like expansion of the tissue. This, you know, kind of doesn't ever go back as far as the fibrous bands. And so for her, it's all about hormones, number one, because she is postmenopausal. So we want to address her estrogen and her testosterone. As we talked about in the previous episodes, these are potent vasodilators. And so a vasodilator just means they're opening up the blood vessels, which means they're feeding the tissue blood flow, rich oxygenated blood, which is going to help with collagen production, tissue regeneration. I feel like we're broken records at this point.
Blood flow.
So, you know, we can help her in a couple different ways. Number one, we can help her through her hormones. Secondly, you know, we can help her with the shockwave therapy because, again, for her, it's not about the fat cells, but it's about these fibrous bands that actually expanded during pregnancy and the skin stretching and the skin thinning. So we want to actually, you know, get those fibrous bands back to where they were. We want to get collagen production back to where it was. We want to start feeding that tissue nice, rich, oxygenated blood. And then, of course, we can't forget, she's got to still exercise and eat right.
Yeah.
Right?
Yes, of course, of course.
Yeah. So, of course, we always tell our patients, you no smoking whatsoever, because smoking is a vasoconstrictor. Yeah. And making sure that you're dieting and you're exercising daily, because what I want you to remember is, let's just say that you go for a walk every day. Think about your heart pumping and how much it's pumping. What I want you to visualize is that heart pumping and all this rich oxygenated blood going into the rest of your body, and it's feeding all that tissue, all your organs. And if it's feeding the tissue and organs good food because you eat well, then that's going to actually repair itself so that it's nice and firm tissue and it's nice and healthy organs. So diet and exercise is huge. Hormones is big, and then shockwave therapy. So if you guys have any other questions, maybe we, didn't address one of them, please feel free to reach out. You can email, call, set up a consultation, and we'd be more than happy to go over those. So thanks for checking us out, and we will see you on the next Novus News.